So today we have 43 new community cases to report. 40 of these cases are in the Auckland region and 3 are in Waikato. There are also 3 cases to report in recent returnees in managed isolation. Now, of today's 43 cases, 19 remain unlinked at this point, but I should say that interviews are outstanding with all those and they are underway at the moment. Of note, and pleasingly, all 3 of the Waikato cases are household contacts who were already in isolation. Of yesterday's 35 cases, 14 remain unlinked at this point, with investigations also ongoing. Now, as you'll be aware, this morning we confirmed that the travelling companion of the Northland case has also tested positive for Covid-19, and both cases are now in the Auckland quarantine facility. There are currently 18 close contacts associated with the original case, and of these 17 have been located and tested and are isolating. The remaining person is being actively followed up by our contact tracers. Our public health staff in Auckland are working closely with both cases to determine any further locations of interest or exposure events and are making progress there. Any new locations of interest will be added to the Ministry's website. So if you've been in Northland or are in Northland, please do keep an eye on that. And of course, likewise, if you are or have been in Auckland or the Waikato, if there are any other locations of interest related to the new cases there, they will go on our website. Meanwhile, just confirming the whole genome sequencing for the original case we had who had travelled to Northland shows that this case is linked to the Auckland outbreak as we had expected. There are 34 people in hospital today with Covid-19, 5 of whom are in intensive care or high dependency units. One of those people currently requires ventilation. We are now publishing the vaccination status of the cases in the outbreak each week on our website. So far that shows that of the 158 people hospitalised to date since the start of the outbreak, only 3 of those 158 were fully vaccinated with sufficient time, that is 14 days to have passed, for them to develop full immunity. It reinforces the huge protection that vaccination offers. And on a separate note, I am very pleased to report today that the Fijian UN worker who was transferred to and treated in New Zealand for Covid-19 has made a recovery and is being discharged from Middlemore Hospital today after 76 days in the care of those there, and I just want to thank all the staff involved in providing outstanding care for this person.
Currently, 82% of eligible New Zealanders aged 12 and over have had their first dose of the vaccine, and 58% have had their second and are now fully vaccinated. In Auckland, those numbers are 87% first dose and 63% second dose. Overall, these are good figures, and according to Our World in Data, put us ahead of the United States and Germany and just behind the United Kingdom. But they aren't high enough yet to feel confident that we can ease restrictions dramatically without seeing a big surge in cases that could overwhelm our health services. So instead of big surges in cases, we want to see a big surge in vaccinations this week. In order to help with that, I have the pleasure to announce today a blast from the past to support and encourage our nationwide vaccination effort. This Saturday between 12 and 8 p.m. on Channel 200 and supported to date by Discovery, screened on 3 and Māori TV and streaming on Hahana Facebook, will be holding a Vaxathon. The Vaxathon will go live across the country, highlighting vaccine initiatives from Cape Reinga to the Bluff, and urging anyone who hasn't been vaccinated yet to make Saturday the day for their first dose, and anyone who has been 3 weeks or longer since their first dose to get their second. The Vaxathon will include real-time data on how each region is tracking with vaccination uptake throughout the day. There will be prizes locally for those getting vaccinated, information from experts on the safety of the vaccine, and some healthy competition between towns and regions. Vaccinations will be available throughout the day and into the night on Saturday across GP clinics, many of whom are opening especially for the day. Pharmacies, marae, churches, mosques, community centres, workplaces and drive-through centres. You can go to covid19.govt.nz to find out where you can get a vaccine locally this Saturday. And if you're a business or community group who wants to support the Vaxathon on Saturday, Visit covid19.govt.nz/Super Saturday. A huge thank you to those who have already come forward. The support from business in particular has just been fantastic. Nationwide, we have the capacity to administer well over 100,000 vaccines in a single day. That would lift our vaccination rates considerably. There is nothing stopping us other than people showing up. Our current vaccination record for a single day is 93,334 vaccines in one day, which was on the 26th of August. And our biggest number of vaccines in a single week is 552,586, and that was the week ending the 5th of September. So those are the records that we should try and beat this week. And Auckland, let's aim to get first doses over 90% by the end of Saturday and see a surge in second doses too. New Zealand has been world leading on keeping down our case numbers, hospitalisations and deaths, as well as delivering a strong economy and low unemployment. I believe we can be world leading on vaccines too and become one of the most highly vaccinated and protected countries globally, which will mean we'll be able to get back on track to safely open up our restrictions that we currently have and get back to something that feels just a bit more normal. But to get there, we need a big collective effort, and we need it soon. The countdown is on, and waiting for your vaccine means we need to wait longer with some of those restrictions, and I know how frustrating they've been. So I urge everyone, especially our young people who have shown great leadership already, to help us get the job done. And ask everyone to do it for children who can't be vaccinated, for the vulnerable and most at risk of getting sick, and so that you can be part of festivals and events safely. I think it's the least that everyone deserves this year.